Dr. Valenti is a visionary. He sees what needs to be done and has the ability to surround himself with folks who can help him to make it happen.
I know that, he just will not use the word retirement. And that's because really, for Bill, his life has been his work. His work in the AIDS epidemic and other infectious diseases really defines who he is, and he doesn't want to let go of that, and we don't want him to let go of that. So I know that he will stay very active.
I think Dr. V's legacy for me is we can break down those barriers. He and Dr. Scheibel took many risks in the early days, and sometimes we have to take a risk to be successful. So that legacy of taking risk, doing things that's not being done today, thinking differently.
He is the methodology by which we operate, which is compassion, care, innovation, always looking for new ways to enhance the patient experience and always looking for new ways to expand this incredible care outside into the bigger community, which is something that I think we're doing really well.
This is not a regular clinic. It's he always wanted that one-stop shop. That was the first thing, actually, when I first met him. That was the first thing that I heard from him. I want this to be one-stop shop. I want it to be, healthcare, but I also want it to be food pantry, want it to be supportive services, case management, things like that, housing, transportation, and it looks like we have that here. So that's the impact.
He was a true leader, and it came natural to him just by the way that he carried himself and carried out his own duties. He brought the rest of us along with him, always with the focus on what we were doing to try to help keep people alive for as long as we could, keep them with their loved ones for as long as we could.
He's made a really big effort since I've been here, and for sure before that, and getting his knowledge into the heads of all of the new APPs and physicians. And I think that he has set everyone up to work really well even when he's not actively seeing patients, because it's been a slow transition, and he's very good at empowering people to work to their full potential.
He loved to be a mentor, as he always said, to the next generation of leaders. And he would always say, connect the dots. And that's kind of what Bill does, is he connects the dots. He brings people together for a common purpose, working towards a resolution or solution that will be in the best interest of the people that we're here to serve.
Dr. Valenti has given so much to our LGBTQ plus community and to the community at large. His dedication to being not only a person who cared for patients, but a person who did research and was innovative. He was courageous, and working with Dr. Scheibel to open CHN.
If you think about all the people that have benefited from what he has done, I think he will continue always being there to support what needs to be done. And he wants to still eradicate this thing. We're going to get rid of this epidemic.
Very early, when Dr. Steve Scheibel and I started this, one of the things he said a number of times was, if we get this right, we'll create a health organization that outlasts us. And I think about Steve Scheibel and talk to him and tell him, we did it. Well, if it's not retirement, then what is it? It's next phase of career. We have a lot of young people who are talented and smart and eager to take over the next phase of patient care. Some of the programs that I oversee. And I think it's time to do that, to let the next generation bring their ideas into this. And as for me, there's still a fight to be fought. So I'll continue to work with the AIDS movement, trying to tell the story, trying to tell the story in terms that this younger generation would understand, because they weren't alive and didn't live through it.
Dr. William Valenti leads the fight against AIDS here in Rochester. He helped to open the Community Health Network in 1989, a place where research and doctors treat 650 local patients. Valenti founded CHN with Dr. Stephen Scheibel.
My mother's uncle, my great uncle, Dr. Jim Chiapetta, was an internist in the public market neighborhood. He had a private office. It was an old school kind of a medical practice where he was in solo practice. And I used to work in his office in the back room opening the mail. And my job was to open the mail and sort it out. And one of the things that I saw very early in this back room work that I had at a very young age was the Journal of the American Medical Association, JAMA, which I read today. And I didn't know what any of it meant, but I knew I wanted to be a part of it, that there was something there that appealed to me. And I interviewed him once for a high school project about, we were asked to interview somebody who had the job that you wanted to be when you grew up. And the last question in this exercise was, what do you think it takes to be a good doctor? And he gave me several things, but the last thing he said was a genuine love of humanity. And I was hooked. Knew it right then. So I started my, as a young boy, with a plastic stethoscope when my buddies and my brother were wearing cowboy hats. So I never had a cowboy hat, but I had a plastic stethoscope at a very early age. In that same era, polio was a huge part of our existence. It was the polio era. And kids in my class contracted polio and left school. One of my friends recovered from polio and wore a brace for the rest of her life, a heavy metal brace, and we would hear her coming into church and into school before we saw her. So the sound of that brace stayed with me all this time. And around that same time, as Carla recovered from polio and wore a brace for the rest of her life, the Salk polio vaccine trial started. The largest field trial ever conducted, ever, with 2 million kids in the United States and Europe who participated in this. It was a placebo-controlled trial. So some of the subjects got the live vaccine and others got the placebo. My sister and I received real vaccine as a part of that. But the real remarkable thing in all of that was that I watched polio disappear. And for the next 2 years, just watched all of that change. So living through that and then watching this vaccine come along and make the impact that it did on the world, just sold me. There was just no place else to go. That I've got to do this stuff, this public health work, and started chasing viruses at the University of Rochester as an infectious diseases trainee fellow, they called him, and here we are. That day, the Centers for Disease Control reported the first 5 cases of what we now know as AIDS. They reported on pneumonia in gay men in Los Angeles and in New York City. And those were the first 5 cases that were ever described. That was the ground zero of the HIV epidemic. The cases had been described, interestingly enough, by Dr. Michael Gottlieb. And Mike Gottlieb had been my medical student and an internal medicine resident at Strong Memorial Hospital, University of Rochester. And he had rotated on the infectious diseases service, so I knew him. And was curious about, what is it? There was something about the cases that was disturbing. There was a pattern of illness that they were describing that made me, first of all, keep that hard copy of the CDC report and also call Gottlieb. And we talked, and I tell the story because it speaks to sort of a turning point in my career where my student became my mentor. I said during our conversation that I had never seen anything like this in Rochester. And he said very quickly, then if I were you, I'd get ready. And he was right, because in the next 2 months, the first case came into the emergency department at Strong, and it just never stopped. It was an explosion. It was an explosive era. All of a sudden, the world had changed. And young people, young gay men in those days, were becoming sick, and many of them dying quickly. What we didn't know was that they had been incubating this virus for years and years, and it had been circulating, but not really knowing it. That whole era is also traumatic and disturbing because of the explosive nature of what was going on and young people dying. Many, your own friends, family members. It just caught everybody by surprise. And we weren't prepared for it. We had never experienced anything like that before. The magnitude of the disease, the type of the disease, the people infected, and still not knowing for sure in terms of how it was transmitted from person to person, and having no drugs to treat this thing for the first 5 years of the epidemic. So we were constantly shooting in the dark. But also, recognizing the need to do something. I mean, you just can't sit back and watch this unfold without. I was an infectious diseases physician. I had to do something. So, I was a gay infectious diseases physician coming out in that era. So there was a lot of that conflict. AZT 1987. The test was approved in April of 1985. And AZT came in the summer of 1987, 2 years later. It was a painful, miserable wait. I mean, when you sort of think back of, well, how effective was it? Well, it's better than nothing. So it was just a time of upheaval, that the usual world order was just sort of totally disrupted. Now, one drug that is expensive, difficult for patients to take and to tolerate, without anything else really in sight. The number of patients that we were seeing, the number of new patients, the increase in HIV/AIDS activity in Rochester was just beyond the capacity of what we could do in the Strong Clinic. It was happening too fast, so we needed something else.
Recognizing that the work that they had already been doing in infectious diseases wasn't enough, that we needed to do more specifically related to HIV infection. And we needed to treat people with AIDS or people with HIV in a comprehensive way. And so they had this vision of putting together the clinic that would serve people in a compassionate, loving and caring way. And I believe that they felt that it would be a one place to go to get all of your needs as a person living with AIDS or living with HIV.
We also thought that our style of early aggressive care would lend itself to doing something like that in the community. Until that time, all HIV care was done in hospitals throughout the world. There was one outpatient community clinic in San Francisco and a small place in New York, and that was it, New York City. So we thought we'd break the mold and try and do it in the community, but there were plenty of legal people, accountants, the Blue Cross Blue Shield architect who designed the space. We converted a bowling alley, the Elks Club bowling alley, into a clinic for the first location of Community Health Networks.
Right off the bat, they had come up with that there were certain services that they needed to have in-house, okay, and one was a social worker. So we started with having that because of the fact that we needed to have the ability to get housing, to get money for food, to help people with jobs they couldn't work. So how could they have some kind of an income? So that was the social worker was one of the first ones that came in. Also adding nutrition, that was another biggie to try to, and the lab. So, and again, when you're saying that, there was agreements with, so we contracted with other places. Some of it, we were able to hire somebody, others we had to bring them in. And so it evolved. AIDS Rochester was really good because if you think about it, in their beginning, they were really dealing with those social issues. Okay, we were dealing with the medical issues. So it was really, they were two organizations, but we were able to find more and more ways. Initially, we couldn't come together the way that we wanted to because of funding streams. If we came together, one would lose the funding stream that they had. So for a long time, we had to just work in a partnership that was separate but together. And later on, then, as you know, we have Trillium.
We said, and we realized very early that your patients are your friends are your patients. And there was just no way around that. Figure it out. Jackie Nudd, who became the executive director of AIDS Rochester, one of Trillium's legacy organizations with Community Health Network, used to say, no one is safe from AIDS here. And everybody knows someone. And it was true. For the most part, those were true statements, and people were impacted by this virus one way or the other. Knew someone, a member of their family, that had been sick and died as a result of it. They had to do something. People just walking in the door or calling on the phone never stopped ringing. It was just incessant with somebody in crisis. And a lot of parents learned about their children. There was this homecoming phenomenon where young men, often with exciting careers in large cities, New York, LA, San Francisco, would get sick and come home. The homecoming phenomenon. And you would learn that your son was gay and your son had AIDS at the same time. I mean, it was a real sobering era for all of us. And these people would connect with AIDS Rochester or some of our street outreach people and need medical care. Mothers, the mothers of our patients. A lot of our patients were young men who came to the office and were brought to the office by their mothers. Some of them too sick to drive themselves. So we got to know this group of mothers. Sid Metzger, the social worker, called them the moms. And what she did was she put a group together of mothers, a mother support group, where they would come once a week and talk. Because, in addition to doing their usual motherhood type things for their children, mostly their sons, many of them had moved back to Rochester from big cities, etc. They were traumatized themselves by what was going on because their son was, in those days, in those very early days, had a good chance of not surviving. But that became a network of support groups in town. In Rochester, a community health network at AIDS Rochester, for specific populations, for specific groups of people, the mothers. The other story that I tell is the story of the neighborhood paper boy, where this kid lived on our street, the street where I grew up as a child. And when he got too sick to come to the office, I would make house calls, and I would go visit my own mother and have lunch with my mother, and then go see the patient and make a house call. And so he also lived in the house of a friend of mine. And they had moved away. My friend had moved away with his family, but the house had a pool in the yard. And I can remember now that I was allowed in swimming pools in that era of horsing around in the pool when my friend lived there. And as I walked to his house, that one day, it was a hot Saturday in summer, and the pool was still covered, hadn't been opened. And his mother met me at the door and brought me inside, and saying that, well, she been taking care of Matthew, and he wasn't looking very good today. And when I told her that my friend lived there, and I remember it being in their pool as a kid, she said that they hadn't opened the pool this year because Matthew was so sick and all they were doing was just taking care of him. And he was in a hospital bed in the living room. And when she offered me a glass of something to drink, but I remember I went over to his bed while she went into the kitchen, and I could hear the ice clanking in a glass, and I touched Matthew on this hot day, and he was cold and not breathing very well, and I thought, that's pretty close to the end. And he had died by the time she came back into the room with the beverage. So she came into the room, and I took her by the elbow and just looked at her, and she knew. She said, he's dead, isn't he? And yeah. She kissed him on the forehead, and then we sat down next to him, and she held his hand, and we talked about him. And she told me that he had been the neighborhood paper boy. And then it all gelled. That's my mother's paper boy. Because my mother, if we had had another child in our family, it would have been Matthew, because my mother loved this kid so much. And she said she would feed him in the morning, give him cookies in the morning, and then she would also say that he was always there. He was never late with the paper. So she had this great friendship with the paper boy. And we talked, and this was one of those pivot points where when her husband came home, we talked a little bit more, and then I got up to leave, and as I was leaving, they had set up a hospital set up in the living room, and there was a sort of a hospital table next to the bed. There was a hospital bed and a table next to the bed, and on the table was his AZT. And I knew what I had to do and had to force myself to do it, but I asked her for the AZT. Could I have his unused medicine, and we'll give it to someone else? Because the drug cost $10,000 a year in 1987. And insurance didn't always cover it. And she said what 100 mothers have said since then when I asked the same question. Of course, if it will help someone else. So we got into the habit of asking people. When she was in grief, she was grieving over her son had just died an hour ago, and she gave me the medicine. So, I mean, that's the sacrifice. It also proves that's the sacrifice that people lived through, but also proves yet again that your patients are your friends are your patients, and everybody knows somebody who died of AIDS. I mean, it just came crashing down on my head that day when I asked her for the medicine. So
he was helping patient by patient get through that with compassion, care, and and I think friendship. He offered his patients friendship, and in turn, they were able to feel comfortable with him. And I think one of the most important parts was that they trusted him. They knew that they could share with him everything he needed to do, everything he needed to know in order for him to make the best medical decisions with them and to offer those decisions to them.
He he just listens to their life stories. I mean, I remember he has a patient that has known her for, I think, 30 years. And I think one of her grandchildren now has had a child, something like that. So he remembers those things, you know. So or she had a grandchild, her something like that. I don't know the correct story, but he remembers those things, and that's the first thing that, you know, he will ask. You know, how is the grandchild? So I think that makes people very to open up more to their, you know, physician, to their provider than anything else, because, you know, you care about their, you know, personal lives and what's going on in their personal lives, instead of just asking, you know, the first thing to ask is, you know, about their health and things like that. So that does make a lot of difference.
Bill is real. He will have a conversation with you. He gets to know his patients. He will ask you about your husband, your wife, your dog, your neighbor, mutual friends. Many of Bill's patients, especially in the earlier days, were from his circle of friends, from our community. So you may have been a friend before you were a patient. Once you were a patient, you definitely became a friend.
I was really impressed with his obvious dedication to the mission. You know, it's not hyperbole to say people were dying. And he took it upon himself and Dr. Scheibel to find ways to have folks not die, live longer, and to get whatever information that they could from these patients to pass it on to the next group of patients. But he was just so driven by the mission and the personal side of medical care. You know, in the pharmacy, it's easy to kind of divorce yourself from the patients. You're not as hands-on as a medical provider, and he really helped me change the type of pharmacist I was going to be. I started to see more of the person that I was caring for, and that was because of him and his drive to always try anything and do more to help the patients out. He became an incredible mentor for me and the type of person I was going to be and the type of pharmacy I was going to practice.
Well, it was a huge challenge, and even though we had huge investments from a large number of people, it seemed like we were always cash-strapped.
There would be days when I would have to go and say, Bill, you got to go on the street and get some money because we haven't got any money to pay the bills, can't pay staff. Many times, Dr. Valenti and Dr. Scheibel did not take even a paycheck just so we could pay bills and pay staff. So it was very difficult, but somehow he would come back with the money and we would be able to survive another day.
The copier story. And there were bright days, and episodes like this are one of them, where somebody had donated a photocopier to us, and a retiring physician in town. And when the copier broke down one day, called the copier guy, and he wanted to get paid. Now, it was $15 for parts was the bill. Well, we had not been paid, Scheibel and I had not been paid that week, because I remember looking into my wallet and seeing $2. So I had $2 in my wallet and an overspent credit card. So I needed $15 in a hurry because he had fixed the machine and we needed the machine to work. Well, above the machine, in our very earliest days, when we first opened, we had framed the co-payments, a $5 bill and a $10 bill from our first 2 patients. And I knew exactly what we needed to do. We took the money down from the wall, took it out of the frame, made a copy of the money, put the copy back in the frame, and paid the copier salesman the $15. We had a working copier, he got paid. We were still broke. But it was that kind of really lean era that defined the mission, the passion that went along with it, because nobody was doing it for the money.
I remember the first time Bill Valenti invited me to go to a fundraiser to pick up the proceeds, pick up a check. He had a little Saab. We pulled up in front of the bar and hopped out of the car, and he popped the trunk. He pulled out a pair of heels and a boa, which he flung around his neck, and we went in and made nice, did the networking, did the chatting, said thank you, as we always do when someone is supporting our organization, like it was nothing at all. He just has the ability to connect to the audience that he's in front of. But I will never forget the high heels and the boa coming out of the trunk without the bat of an eye.
Well, the good part about all of that chaos, was that it mobilized people to do something, that you had to do something. And this community is a huge example of that in terms of mobilizing, bringing people together to advance the cause by volunteering to work with patients, taking patients to medical appointments, making meals, delivering meals, raising money, having fundraisers, all of those things.
For Jeffrey Barhyde, being able to rollerblade like this is more than just a marvel. It's a miracle.
I expected to be dead long before this. So this is fabulous. This is, in a very strange way, the best thing that ever happened to me.
So what happened to Jeffrey? He was diagnosed HIV positive 10 years ago. He says he owes his life to the treatment he receives at Rochester's Community Health Network. In an act of thanks, he got officials to close all 4 lanes of the inner loop for a rollerblading fundraiser. Proceeds go straight to the Community Health Network.
Not everybody has insurance or Medicaid, so we subsidize a lot of the medical care for the people that we see. We take any patient regardless of their ability to pay, so this helps us do that.
It was all productive, but it was different. Some of it was noisy and disruptive, like advocacy groups like ACT UP and Treatment Action Group stopping traffic. I remember once I was lying in the middle of the intersection at Goodman and Monroe. A group of advocates had marched to that intersection, and we were protesting. Lack of research funding. And so I was lying down next to several people, and we heard police sirens in the background. And the guy next to me said, "Doc, you know, you're really no good to us in jail. Why don't you get out of here, and then you can come bail me out?" And that's exactly what I did. I've often said since then that, you know, I've never been to jail, but I've bailed a lot of people out. Where that all of that went was a global movement in terms of AIDS advocacy. And there were groups all over the world who were doing the same thing, being disruptive in an effort to get action. The protests were, some of them symbolic, beyond blocking traffic and intersections. The photo that I recall is of one of our nurses, Lisa Brozak, and our early development guy, Ken Maldonado, went to Washington, D.C. to a protest, and they brought a patient's ashes with them. The photo shows one of them holding a photograph of the patient and the other holding a jar with his ashes that they went and spread on the White House lawn with other advocates as a symbol of, you know, there are people dying out there. Other art of the era shows blood on your hands. Reagan with blood on his face spattered with blood. But yes, some very graphic and symbolic gestures to talk about the death and dying, because some people recall the era by talking about we would go to multiple funerals and memorial services every week, 3 or 4 a week in those days. And those are people who are part of the community, who are having part of living the experience, who are talking about it. It was obvious that it was falling on deaf ears in the White House, because the Reagan administration really went dark.
He knew how to communicate, and that was extraordinarily important throughout his career, but particularly at the beginning of the AIDS epidemic.
Well, I was the major person doing HIV work, and had a friendly relationship with the public affairs people at the medical center because of my previous involvement. My previous job prior to HIV was as the Strong Memorial Hospital's hospital epidemiologist, the disease detective in infectious diseases that, as I said, chased viruses and other exotic infections around to try and make sense of them. And I had 2 nurses who worked with me in this infection prevention program. So I got to know a number of the people in public affairs, and they began to talk to me and come to me during when the AIDS crisis emerged. So that's how that happened, an outgrowth of my infection prevention work. It gravitated into AIDS and began the being at one time the university's spokesperson on HIV-related matters. And I learned a tremendous amount from that experience because, well, first of all, my mother was a great fan, but also slightly critical in terms of, well, don't you think you could have done just a little something a little different, or maybe a little shorter when you tried to explain that because it was awfully medical, that kind of thing. It's been a privilege to have, it's been real, I really appreciate the opportunity and take it seriously in terms of, give this your best shot here in terms of something that is brief and understandable.
One of the beautiful things about Bill is in the early days when there was such a stigma attached to being HIV positive, when people looked at you like it's your fault, that you did something wrong, that's why you're sick. And Bill was able to cut through that. And he was able to make sure they understood that it wasn't their fault. They had a disease. They are infected with a virus. And we need to treat that virus medically, but also help them through making sure that they have the mental health and emotional help to get through a very difficult disease. And in the early days, one that may be fatal, to now one that is a manageable chronic illness. But it was Bill's ability to put that noise aside. It had a place. We had to deal with that because that's discrimination at its worst. But his ability to put that aside so that he could help the community and help people understand that folks needed to get the health care that they deserved. So those were the earlier days. And now he's a spokesperson helping to educate people on how we possibly can get to a point where we end the epidemic.
Clearly, he was the community expert on HIV in Rochester. I mean, everyone, when there was anything in the news about HIV, people would go to Dr. Valenti. But I have to tell you, I've thrown his name out a lot nationally. I work with Bill Valenti in Rochester, and people know him. And I recall there was an event here at Trillium where he was presenting, it was on PrEP, to the World Health Organization. And I kind of gathered staff around and said, do you guys realize he's talking to the UN? He's really a big deal. I mean, he's not only obviously the community expert, he's a nationally known expert, an internationally known expert. Way ahead of the curve. I mean, he set the standard, right? This organization set the standard for community HIV care, caring for the whole person. And he said, look, the pharmacy needs to be here as the patients are going out because we need to make sure they're getting their medications as the patient is leaving. And so he worked with my boss at Southside. We're going to figure out a way to offer pharmacy services because it's critical that patients leave here with their medicine, go home, and start taking their medicine. And that model, that's been replicated everywhere. And that I know of no other community-based organization like Community Health Network, small city, that had that concept of everything under one roof. We're going to care for the entire patient.
So when I reflect on what Dr. Valenti and Dr. Scheibel did in the early days of breaking down those barriers, that's what that integrated care model was all about, is thinking about why an individual can't come into the clinic, what are the barriers to receiving that care. It could be stigma. It could be housing, transportation, the traditional barriers that we think about today. But it's those other elements like stigma, judgment that was very prevalent in the early days of HIV. And Dr. Valenti and Dr. Scheibel, they were there taking risk to see patients, find ways to be creative in how we provide care.
Bill was a pioneer in understanding that you couldn't take care of health unless you took care of the other needs that an individual had. I mean, things like a bed to sleep in, access to your medication, food security, housing security, and that stayed from Community Health Network to the transition into Trillium Health, to providing that foundation for us to expand all of those services.
The original idea that I thought we were going to go with was a private practice, a physician's office that did HIV care. And Pearl Rubin, who was the executive director of the Daisy Marquis Jones Foundation in Rochester, which is a big funder of healthcare charities in those days. And we met to talk about this project. And she said, "You're not talking about a doctor's office. This is a not-for-profit. So get an attorney." And we did. And that turned those kinds of things, those kinds of interactions with people in the community who knew what they were talking about, made a huge difference in terms of the shape it took, where it went, what it looked like, what it evolved into.
You know, in the beginning years, in the beginning of the crisis, it was a death sentence for most everyone. And to move through the periods of AZT, which was a horrible medication that, you know, the side effects, the adverse side effects were tremendous, to dual medications where you know, you had to keep the medications cold and you had to take them 6 times a day, or you had to take 12 pills or things of that nature, then to the cocktail approach of 3 medications combined. Dr. Valenti worked with patients through all of that, to the point where now he's working to help us end this epidemic by making sure that we get people tested. If they turn out to be positive, that we get them into treatment so that they then can become, the virus is undetectable, and if the virus is undetectable, then you can't transmit it. And if they turn out to be negative, that we continue to educate them and we help them to prevent becoming positive through PrEP or PEP, or just by, you know, the activities that they're engaging in. So Dr. Valenti was part of that entire medical journey, and he was at the forefront.
It was incredible to see that evolution. It really was. In the beginning, it was death and dying. You know, that's all we talked about. And all of a sudden, people were living.
It's a remarkable public health achievement that we've been watching here, that we've been participating in all these years. And there's more to come, because the drug development piece will seal the deal. I never, ever would have imagined an injection that would work for 6 months instead of pills. So what I'm saying is that new drug development is continuing that will also change what we now know as HIV prevention and treatment, and we'll be in a completely different place a year or 2 from now.
Yeah, the first time Dr. Valenti even mouthed the words "end the epidemic," and I said to him, I can't believe we're even saying that. Like, looking back at what we were dealing with before, and that we're actually even looking forward to a time when there is no AIDS. That's remarkable to me. And I look at the pioneers like him and Dr. Scheibel, and that optimism and that stick-to-itiveness that we were going to focus on the larger picture, keep forging ahead, never give up. It really helped pull along all of the staff working with them. You know, we all followed along.
It is so personal to him. His passion is ending the HIV epidemic, and he always says there's still work to be done.
He's been a great mentor with me, and he has a lot of like little one-liners that sort of make me chuckle, and I'll miss those one-liners, like "this is a test of your leadership," or "you need to take it to where your comfort zone is and then take it even more." You know, like that's what you need to work on. That piece of it, it's definitely more of a he pushes me to be more bold, more daring, more thinking outside of the box. and that's really nice. But I can always pick up the phone, and he would continue to push me that way too.
For me, the thing I'm going to miss is the cheeky smile. Every time we're having a leadership meeting, I can look at Dr. Valenti's face and I can read him immediately. And when that smile just starts to appear, or I can just see his eyes looking at me, I'm like, okay, Dr. V is going to say something. Let's be prepared and let's have a conversation. But I really, I am going to miss Dr. V always challenging us. He looks through so many lenses, different perspectives, and always challenges us to do the right thing for the organization. And it can be through our patients and clients, our staff as well. Is we want to make the right decision, but at the end of the day, it's all around providing what our mission statement says, that judgment-free, compassionate care as well. So those are the things I'm definitely going to miss, because I always know Dr. V's got a comment to say, and I always listen to it.
You know, his contagious laugh it's contagious, and you can't help but feel the love and the compassion he has. And sometimes he's very mischievous, which I also love about him. But he had been by my side for almost 10 years, and Trillium Health wouldn't be where it is today without Bill also helping to influence its direction. And
I was amazed at different times when I sat next to or near Bill in a meeting where he was going to be presenting. He is so full of knowledge, as well as having that unique Bill Valenti personality. But I remember sitting there as he's listening to the speakers before him, and he would grab a napkin and he would just be taking these little notes. And then he would approach the podium, take the mic, and those few little notes, he would let bloom or make bloom into a powerful presentation that engaged the audience, brought a point forward, and solidified that point, often with a plan of action to go along with it. I wish I could make a napkin do that.
I said I will not be emotional. I always took that as my honor and privilege to help him. I always enjoyed our time. We will always touch base on a lot of things, what's happening in our lives. So that was kind of our time together. So I will truly miss that. It's a small thing, but for me it was a very big thing to, sit down with him and kind of catch up on things and help him complete his notes and, finish everything that needs to be finished.
The more I got to know Dr. Valenti, both, his professional work and getting to know him as a friend, the more I admired him and was awed by him. He's an extraordinary human being, and I feel very, very proud to be able to call him not only my hero, but also my friend. He, of course, is so self-effacing that he will always sort of defer the question by saying, well, it wasn't me. It took a team of people. There were so many people that helped with this effort in both prevention and treatment of AIDS and developing these community systems to treat AIDS. So he always talks about the team. But the fact of the matter is that he's an incredible leader. I mean, those teams never would have been except for his leadership. He's somebody that is a leader in the sense that he can inspire people to his vision. And his vision was a world without AIDS from the very beginning.
He leads by example. So because of how much he truly cares about patients, their human side too, not just their medical side, learning who they are, he shows us by example that that's really important in medicine. And it is huge because that is how you gain rapport with patients and how we're able to give more and more of ourselves because we're treating a human, not just a disease process. He's also very good about reminding us where we came from and educating us on the historical pieces, the little stories that happen in the rooms, or the photographs that are really touching and memorable, to keep everybody grounded on the why we're here, and to keep it all in perspective, keep it all fresh.
We have been trying to raise some money for a patient to take her kids to Disney World. She was dying. She was 30 years old. Her husband had died of AIDS 2 years before, and she had 2 toddlers, kids, like kindergarten. Her mother would come to her for during appointments. The kids would play in the waiting room. And one day I said to her, I can still see it, that on the fly, if you could do anything in the world, what would you do? And she said, take my kids to Disney World. Didn't miss a beat. And I thought, all this media connection we have, I called Dina Bunis at the DNC, the reporter at the Democrat and Chronicle, told her the story. During the week of Christmas, they wrote the story of Mary. Her name was something else, but they called her Mary. 2 young kids dying of AIDS, and she wants to go to Disney World. People started to send money to us. You know, she did take the kids to Disney World. The trip of a lifetime, they reported that in the DNC as well when they returned. And she came to the office one day after the trip, all smiles, kids happy, grandma happy, they all went, grandmother, the 2 kids, and Mary. And she handed me a bag that had a Minnie Mouse sticker in it. And I put the Minnie Mouse sticker on the door of my laundry room in the basement, where it remains after all these years. And there's more to the story. There's the coda for this story is about, well, it's probably been 5 years now. Remember, this was 30 years ago when this whole thing happened. The story of Mary went to Disney World, raised enough money to send her to Disney World. I received a call from a man who identified herself as her son, Mary's son. The grandmother had died. Mary died. Patient died. And they were raised by their grandmother. And he identified himself as her son. And he said that his grandmother had died. And in her things, he found the newspaper articles from all those years ago. And never knew how the trip came about, but talked about the trip and said that it was the best time they ever had with their mother, because most of the time their mother was sick. And he thanked me for helping make the trip possible. And he said that he was, as a result of all of that coming together, wanted to take his own family to Disney World now. So grandmother didn't let on what was going on. My recollection is that they knew of her illness, but they didn't know the nature of how the trip came about, but remembered the trip very well. So what I tell people about that part of the story is that the work you do will affect not only you and the person who's sitting in front of you, but might also affect generations to follow. So get it right. Don't be remembered as somebody who messed up or didn't go the extra mile. Just do it. So that's part of our just do it.
There's no question he saved lives. I mean, there are people alive today that have contributed back to society that are here because of him. His reach is beyond even the patients. I mean, I look around at my life, and my wife recognizes this as well, and we look at how lucky and blessed we are, the house we live in, the family we have. So much of that is because of Dr. Valenti. He made the decision 35 years ago, more than 35 years ago, with colleagues, on that porch, to open this health center for patients affected by HIV, and it profoundly changed my life. The life I have today is because of him, and I don't even know if he himself recognizes what an impact he's had, not just on his patients, but on all the people that have come in contact with him over the years. He's a treasure to the Rochester community. He's beloved by so many, and there's so many people like me that owe so much of what they have to the decisions that he's made over the years. And I hope he recognizes the profound positive impact he's had on so many lives, and not just the patients.
But he will always be the DNA of Trillium, and I know that as long as he is able to, he'll be in here ready to advise, ready to troubleshoot, ready to just be a presence, and that's just the way he is.
I'm looking forward to continuing that relationship with Dr. Valenti, having him in the background, continuing to support us. And I know he's never going to go away. He's always going to be there. And I know in my own mind, he's always going to be there in terms of, I'll be saying, what would Dr. Valenti think about this in terms of how we design programs, especially those that are still supporting our HIV patients? That's a legacy that we are not stepping away from, and we will continue to support ending the epidemic and using Dr. Valenti's voice to reinforce that in the future as well.
I think his legacy was being on the forefront of standing up when people needed him. He didn't have to go down this journey. There's lots of other things he could have done. He could have stayed at the University of Rochester and not opened the clinic. But he chose to open the clinic because he understood that our community needed him. And so I think his legacy starts with having the courage to take that leap, having the courage to open up a clinic that was different than other clinics, modeled after some, but to offer a comprehensive health care system that had supporting mechanisms to it, like pharmaceutical and mental health, and now housing to some degree, and nutrition, and all those things to keep people healthy. That was a risk. He took a risk. And so I think his legacy starts with having the courage to take the risk. But I think his legacy ends with being a person that just wanted to make it better for other people. How could he help other people? And in this context, help other people who are living with HIV or living with AIDS. How could he help them? And that's his real legacy, is putting people first and putting himself in a place where he could help others.
Something starting from very small and building it to where we currently are, that's the biggest impact, because how many people this place have affected in a positive way through the years. That is the impact. That's something that not everybody can do. So that's the impact. And I don't see it only, yes, HIV community, but I see it as a pioneer in the health community as well.
He's never not going to work. He's never going to truly retire. He won't be seeing individual patients, and he knows that he has to pass that Trillium work on to the next generation, because it's time for them to take the baton and lead. And as they lead, they're going to be standing on his very big shoulders. We've had him in our community and appreciate all those things that he's done, but really he has a global reputation. Communities from all over the nation, all over the world, look to him for advice and models of how to prevent and treat AIDS in communities. And so, his impact is really worldwide. And I can't even think of the, numbers of thousands of patients that he's either saved their lives or vastly improved the quality of their lives.
He will never be away from this. He will always be there, and he'll always be a spokesperson for it. And if he can encourage anything in the United States or worldwide, he will. So it was, again, this wasn't a Rochester thing. He was all over, and I think that he'll continue to be that way.
It is impossible to fill his shoes, either the wingtips or the stilettos. He is one of a kind. Our organization will continue because of the foundation that he started.
I'll miss the interaction with my colleagues, the sitting at the nurses' station, the back and forth. I'm going to miss that a lot. And then I will also miss my patients and their stories. Because, as I've said many times, I've learned something from each one of them. It may not be on the fine points of medicine or how to treat pneumonia, but I've learned something. I said earlier also that my patients have taught me how to listen. Someone asked Steve Scheibel on opening day about Community Health Network, and the question was, what if CHN doesn't make it? This is on day one. So his answer was, and he could have been very undiplomatic, but Steve was just as smooth as could possibly be. He said, we can't fail. The work is too important. End of discussion. He did it. Thank you for allowing me to be the catalyst, that I've had the opportunity to develop my own ideas, almost always with the encouragement and support of other people. That is a rare opportunity. And I look back and think about that and think about, don't mess up. You've got just a little time before you go to the next phase here. But I think the trust that people have given me, that have allowed me to guide, because I didn't do it by myself, I really didn't. But I'll also acknowledge that if I was anything, I was the catalyst. And thank you for the privilege of letting me do that. because it has been a wild ride. It's been an extraordinary experience that not everyone will have that.
Dr. V, I cannot adequately put this into words, but thank you for your decades of friendship, mentorship, your compassion, your examples of leadership, your patience, and your insistence on excellence. The Rochester community and the world is grateful for your service. Well done, and thank you.
I just really want to say thank you for, first of all, setting up this amazing organization that has done such good for our patients and clients over so many years. Thank you for being a wonderful teacher and mentor to me, and having faith that I could do it, and we can do this, and we'll do this together, and we'll continue to do it with you.
Bill, it has been a long and wonderful journey for me personally. You have inspired me professionally and personally. You've informed the way that I interact in this world, in this community, and at any job that I undertake. You are the heart of this place. You're in our DNA, and I am so grateful to you for giving me a safe space as an ally and somebody who lost family to the AIDS epidemic, but for giving me a home here with a community that really makes my heart full. So thank you for everything. You've touched millions of lives, I am sure, and mine is one of them. So much love to you, and I will see you around.
Dr. Valenti, I wish you all the best in this next chapter of your life here. I'm excited to see what you do next in terms of starting to slow down a little bit, enjoy some time with your husband, do some of those fun things that you enjoy doing, like traveling, getting to see more of the United States, and I just really wish you all the best, and thank you for everything you've done for Trillium. You've had such an impact on our community, what we do every single day, and I know you've had an impact on me. If it wasn't for you, I know I wouldn't be with this organization. The relationships we've created over the years has been so important. So wishing you all the best, and we'll be in touch. Take care. Love you.
Oh, my dear Dr. Valenti, what am I going to do without you? We've been at this for a long time, which is surprising because you're 38. No, you're 39. I'm 38. So many memories, so many good times, so many struggles that we've been through together. I look forward to seeing you move into the next chapter and moving right alongside you, because I'm not afraid to say the R word and it's not far off.
I wish you, Bill, nothing but the best in this life journey and all the wonderful places that it will take you, because you deserve it, and I love you. Best wishes.
So, Bill, I can't tell you that I'm not very, very disappointed that you're retiring. I truly am. But I understand after decades of service to our LGBTQ plus community and decades of service to Rochester as a whole, you've earned your time to step back a little bit and not do direct patient care, but I understand you're going to continue to be involved in Trillium in some ways. I just want to thank you for your courage in taking the risk and opening the clinic, the community network. By doing that, you literally have saved lives. And having gone through the years when so many of our friends passed away, and I know you said goodbye to a lot of friends and patients, we're now at a point where as you move on and do other things, you've set us up so that people can live long lives with HIV, they can live quality lives with HIV, and they can continue to be important folks contributing to our community that they might not have otherwise been able to do without the work that you did on infectious disease and on HIV in particular. So I want to thank you, Bill. Thank you from me personally for what you have offered me as your friend, but also on behalf of the community. All you have done to help us grow through a crisis to a point where we are able to have many people live quality of life while at the same time living with HIV. Thanks, Bill. Good luck. Enjoy your downtime. I don't think you'll have much of that, but enjoy it. And I love you, buddy. Take care.
Oh, Bill, you know I think the world of you, and I am so proud of what you have accomplished. You were courageous in the early days. You continue to be supportive and caring, and that will never go away. I know that you may be leaving medical practice, but I know that you will continue the fight, and you will want to continue to see all the progress we can make to no longer have an epidemic, that we will have something that will become just a chronic disease. And I think we're getting closer and closer, and it will happen, but it will only happen because of the work that you did. Personally, I want you to have a wonderful next stage of your life. I hope that you will start to do the things that you should have been doing and that you didn't take the time to do. So I want you to do those and enjoy it, and I look forward to continuing to be with you, especially to celebrate our Valentine's Day.
I wish you a happy semi-retirement. And I hope you get that train across the country, train ride across the country. So I just wish that, you do that really soon.
Oh, Bill, I don't know what to say. It's you're an extraordinary human being. You're an extraordinary physician. You've changed the face of AIDS prevention and treatment and community health all over the world. I have been warned, in the past never to meet your heroes because your heroes will disappoint you. I met you almost 25 years ago. You were my hero then, and you're even more of a hero the more that I get to know you. Giovanni and I love you, and we will continue to support you. We'll continue to support the work that Trillium does because it is so crucial to our community, and I'm really looking forward to continue to work with you through the foundation. I love you, Bill.